Now, following the delivery of your baby, the cord is actually clamped and the baby is tagged, and the midwife will then initiate what's called as an APGAR score, where she will check the baby's breathing, its heart rate, etc. And this will be repeated again in 5 minutes. But once the first APGAR is done, the baby is actually put onto your chest for skin-to-skin contact.
After delivery, your baby is given an injection of vitamin K.
Following the initial APGAR check, which usually occurs within the first couple of seconds of birth, there's a second APGAR check occurring usually about 5 minutes after delivery of the baby. So your baby will be rechecked by your midwife. At this stage, if the baby hasn't been weighed already, the baby will be brought over to weighing scales and the weight will be given to you initially in kilograms and then converted to pounds and ounces, so you can let your friends know what weight your baby was.
Very few newborns look picture perfect at birth. They can appear squashed, puffy-eyed, wrinkly, even bruised from the delivery. Most, if not all, of these are temporary. Because the infant's head is usually the first part through the birth canal, it can be affected by the delivery process. The head may be pointed from the skull bones, the fontanelles, overlapping during the journey out. If your baby was delivered by forceps or using a suction cap, there may be little marks on the head, but these will fade within the first few days. Your baby may come out with a head of hair, or completely bald. Any hair is likely to be replaced, probably with a different colour and texture. There may be some hair on the body called lanugo, which kept them cosy during the pregnancy. The muscles that control a new baby's eye movements are still very weak, so they may look a little cross-eyed at first. After a month or so, the muscles will have developed enough for the eyes to work together. Immediately after delivery, the umbilical cord is cut and a plastic clamp is placed on it. Over the next few days, the cord will darken, shrivel up, and then drop off. A few minutes after birth, most infants open their eyes and start to look around at their environment. Your baby can see quite well at birth, especially things that are close. They can also hear and may be startled by loud noises. Your baby will recognise your voice from hearing it in the womb. Infants are born with a number of instinctual responses to stimuli, such as light or touch. They're known as primitive reflexes. These gradually disappear as the baby matures.
You're picking up babies to hold them, make sure that you support the head well. This is the cradle hold, which would be very, very common hold. So see, I've got the baby's head well supported with my elbow, my arm here, and it's a nice, comfortable, firm position to hold a baby and very secure. That is one hold that's very, very common and you feel very comfortable with it. You also can use the shoulder hold. So again, when you're picking your baby up, you see the way I'm holding onto the baby's head. I'm bringing the baby right up and just give them nice hold. And again, up onto my shoulder. That's a lovely way to get upwind. And the third hold then is the football hold. And that's again putting you're always supporting the baby's head. And you're holding the baby, so you're holding the baby's head with your hand like that. You see what I'm doing there? I have a nice secure hold on the baby again.
Changing your newborn's nappy is one of those things you'll be doing 7 or 8 times a day, so it's best to be organised from the start. Make sure you have everything you need ready and close to hand. Place your baby on a clean, soft, flat surface. Open the nappy and wipe away excess stools from the genital area with the corner of the nappy. Hold your baby by the ankles and lift up their bottom. Use soft cotton balls or a wet cloth to clean your baby. Clean around the umbilical cord area. For a girl, be sure to wipe from front to back. This will help minimise the spread of an infection. Swap a clean nappy for the dirty one. Use the tabs to see which way goes up. Avoid covering the umbilical cord as this can cause irritation. For a boy, keep his penis pointed down. Fasten the nappy at both sides with the tapes, making sure it's snug, but not so tight that it pinches the skin. Retape the soiled nappy around the contents, put it in a plastic bag and discard it in the bin. Dress your baby and wash your hands thoroughly. Babies wet their nappies several times a day. The number of wet nappies is a helpful sign of how much fluid the baby is taking in. Generally, a baby should have 5 to 6 wet nappies each day. This is a good indication that they're getting enough milk. In the first days after the birth, various tests and health checks will be carried out on your baby.
The newborn screen is performed to look early for conditions which are treatable. These conditions are rare, generally rare inborn errors of metabolism or metabolic disorders. The blood is taken from your baby's heel and the blood is put on a newborn screening card. If there were any abnormalities identified, you would be contacted. In most cases, the results from this test are completely normal and reassuring. The purpose of the detailed physical examination performed by a member of the paediatric team at 24 hours of age is to detect minor or major abnormalities and to make sure the baby is well to go home. We're also very interested in discussing with the mother, with the mum, how the baby is feeding. Is the baby feeding well? Whether mum is breastfeeding or bottle feeding baby, we're very interested that feeding would at least have become somewhat established before baby would go home, that baby is keeping feeds down, not vomiting up all the feeds, and that baby is passing urine and that the bowels have moved. We check all the reflexes in the newborn baby prior to discharge home. These would be that the baby has normal head control, that baby's muscle tone is normal, and there are certain what we call primitive reflexes in the newborn baby where we look for proper and correct movement of the baby. And generally on the newborn exam we have a completely normal examination, check the baby's measurements and decide that baby has established feeding and is therefore fit to go home with the mother.
Once discharged from the hospital, please get medical advice if you're not happy about any aspect of your baby's condition.